in 1998. It's a big story. But I may be the only person in that whole group who never needed any appointment, any invitation. If you happen to be in Hopoli, there is a Vardhashram called as the Matosri Vardhashram, and it is a gem of a person, definitely. So friends, I appreciate the organizers, and I must thank you the previous speakers also. The previous speakers have done a great job. Okay? A request to all of you, आपके ग्रुप में जो भी कोई तुम्हारे फ्रेंड्स हैं ना, उनको बोल दो that they should not miss this opportunity. Because next 40 minutes, you are going to see something which you have never imagined. आपने जो कभी सोचा भी नहीं, जो देखा भी नहीं, वो सब मैं दिखाने वाला हूँ. Okay? So please send a message to all of them. This is about me. I have to stamp that I am a professor emeritus because 71 years old, and I hold all other organizations. I bring you greetings from my working medical college. This is Indian Medical College from Panvel, Navi Mumbai. It is actually on the backside of McDonald's, EBS to say. But there is a big medical college NGM on the other side. Kamoteswar has been a very frequent examiner there. And they are all our great people. Don't go on the age of this person. He is 92 years old. The MTech from IIT. But Mr. Kamal Kishore Kadam had guts enough to start medical colleges at that time. I really appreciate this man's zeal and enthusiasm. I bring you greetings from this place. Any idea where it is? And what was this? There were all crocodiles in this area. This has been converted into Navi Mumbai area. Same place, same place. What I am going to share with you? I am going to share with you a journey of 50 years. 1974 I got admission to Virat Medical College. This was my alma mater, anatomy department and one place hospital. If you are not aware of the geography of Maharashtra, Virat is a place in the southwest part of Maharashtra. And the first open cardiac surgery took place there in 1953. One of the best administrative academic hub for all the healthcare. We used to get patients from Bengaluru, some people from Chennai in years of 1980, 81, 82. Because our mission hospital was having equipments brought from USA directly. Birds Mark 8 I have used in 1981, cannot imagine. It was not there in Bristol years. So I can't forget my alma mater. So I am going to go in a Satya Pe Satta format. Okay, only 7 points to be discussed. And what are the points? I am going to introduce to you and tell something about the history of AI. Basic principles, what are the foundations of AI? How it helps you in medical education, year-wise, first year, second year, third year. How it is going to help you in research, publication, presentation, very important. Sir, might have taken 2 hours, 3 hours to make a presentation. You guys can do it within 2-3 minutes. Okay, that is the beauty of AI. What are the future directions? Last but one is from where to learn, from where to get trained, where to get taught, and where to publish your work. And what we can do at our status. What we can do at our status, how we can help to improve our personality. Friends, we are really lucky. So at least me and sir, we have seen the Dappa type of phone. Lal box used to be 1 rupee coin. Now all the phones are in your, not only phone, a laptop is in your pocket. So this is the evolution of the industrial evolution. And the concept of AI was first thought in 1955. Imagine, it is AI as old as me. I think that may be one of the reasons why I am so much affectionate to it. And there was one person who had a conference in Dartmouth, USA, and there the first terminology was conceived, that is artificial intelligence. Actually, there is nothing artificial in there. It is all natural, only it is augmented, adaptive, and how you accept the current situations around you. So initially the artificial neurons were discussed in 1953. And if you know something about the history of the world, Second World War was won only because of the concept related to AI. And then after we have come very long age, there is something called as the AI winter, and everything has changed after introduction of what? 5 words, ChatGPT. Okay. So this is all evolution over time, 1950, 57, then 1970, 80, and 2022 saw a concept called as a generative AI. So what do you mean by generative AI? Generative AI learns from yours. It learns from its own mistakes. And if you recall, last 2 months back, there was a fantastic conference in Delhi. And what our Prime Minister wanted, he wanted an AI-enabled healthcare system. What are the 4 components of it? Early detection and screening of every disease, including Alzheimer. Enhanced clinical decision support, CDSS. I know what kind of OPD you must be having. I have seen it everywhere. PGI, Chandigarh is more crowded than Chandigarh station. Hundreds of patients waiting. So you need a CDSS. Then bridging the gap or bringing the last mile, the last person who that was the Mahatma Gandhi. And we have to improve our public health and sanitation. So what are the things which we discuss in India AI Summit? 3 foundation pillars. Number 1, it should be for people. Then it should preserve the planet, and we should progress all together. Then I was talking of generative AI. This was the foundation ChatGPT. Foundation ChatGPT means you ask the question, it gives you answer. But it had a limit that we had a data only up to 2022. It makes language model accessible, human-like text generation. AI became mainstream, and initial applications were for communication, learning, coding, and simple automation. Have you tried any time multilingual aspects of ChatGPT? The same thing you can get in Marathi, Gujarati, Hindi, any Zulu language also you will get. You can tell that I want advice on diet for obesity in Zulu language. It will give you. Only thing you have to understand that language. What happened later on? 2023 post-COVID. What came? Multimodal AI. What do you mean by multimodal AI? It was understanding text, images, and audio. All of us, we are using the audio of ChatGPT. Just go on talking it with a proper prompt, it will be a fantastic answer. Then there are AI agents which are autonomous task execution and coding assistance. So all the automatic work where you require Gada Mazduri, that is going to be taken care by AI. And this is an open source innovation. What is that? Large language models, and there are open models. Then the integrates text, vision, coding skills, and open mobile operation of AI research. And what we are going to see a jump in 26, AI which integrates text, vision, coding skill, open models, and popularizes AI research. That is what we are going to see right in 2026. Then there is an industry adoption. We have seen healthcare, education, business, and law. After 26, you will be getting personalized. It learns from preferences, remembers past interaction, your performance, and it manages personal productivity and health-related tasks. And what is the next step? It is called as artificial general intelligence, which envisions the goal of self-learning and autonomous task completion. You just talk to the agent saying that I have got a 50-year-old male. He presented with all complications of malaria. The PDF is attached to this file. Please prepare me a test summary. Within 2 minutes, you will get a summary without losing a single detail of that patient's clinical history. But there is one problem with all of us. We medicals, we are laggards. Laggards is what? We don't want to adapt to new technology. So for that, what we have to do, at least for people of our age, You have to unlearn, learn and relearn. Who taught you to do WhatsApp? किसने बताया था आपको? Gmail बताया था, Google Maps, Facebook. There are many odds and ends, but unfortunately we don't have systematic learning. We do learning on our own. Typing is one of the best examples. You adopt typing tutor, and with typing tutor we can type much faster than the conventional one finger typing. So there are people who adopt it fast and they reach their peak in technology. But on the other side, all people of my age and before that, they think that no, old is gold. But friends, gold also needs polish. We have got a great disparity, patient only. Our staff is very experienced, witty, they are wise, but we lack data. If I ask you that how many number of falciparum malaria were admitted in super hospital last year, somebody has to put data about it. We do less documentation. Because of the less documentation, we do few publications. And AI tools can reverse all the things. I'm sure, sir, all these boys who are attending here, they are going to be changed persons from tomorrow. Because they will know how to use the right model. I know that my topic is absolutely diffuse. It is defocused because I have to tell you everything. But it will anchor something definite, standalone, critical action which will improve your practice. You may be getting something unique for your thing. The other person may be getting something else. And AI is all around us, universal, ubiquitous, everything in clinics, hospital, courses, conferences. We must know the right way of using it. What is called as a prompt engineering. You know the concept, gold in, gold out. If you put gold words, it will give you a good output. Every slide is incomplete. I am going to give all these slides to you. You can use it anywhere. But don't take out the footer. That is my copyright. Let people know. Every slide is not complete and there is something called as a 3M interaction. What do you mean by 3M interaction? Man to machine to machine and machine to man. You have got a Fitbit and you put a deadline of 10,000 steps. It tells you 10,000 steps completed. I have got a sensor which takes my blood sugar and if it goes below 70, it will give me alert that I am likely to go to hypoglycemia. And there are smart insulin pens and pumps where the pump talks to the insulin pen. Because this fellow has got huge amount of Srikhand in the afternoon, his sugar insulin dose has to be increased because the figure has been coded with that. These are the three ways in which people connect to each other. And these are the new words which everybody knows. This llama, Claude, then Anthropic, Meta, they are all more or less similar. They have got AI agents, they talk to each other and they give a good output. There is a disclaimer for this. I am not an expert, I am not a coder. I started my love with technology almost from 1998 to 99, or I think Aditya can tell me 1988 when my first son was born. I don't have any degree in AI, even though I am a dean, but I procure, practice and preach about data science and AI. Either से कितना भी माल मिलेगा, I collect it together and I distribute it free absolutely. And like all medical innovations were ridiculed, people initially looked to me also as a crazy, and I am not an exception. But I didn't get disappointed, and that is the reason you see a organization, Indian College of Artificial Intelligence in Medicine. There is only one journal, sir. It is the International Journal of Artificial Intelligence in Medical Medicine, and I am the executive editor of that. It is somebody from your side also will be coming, you will be making publications, and you will be one of the authors. So one very simple question, how do we learn? Right from finger count, abacus, calculators. Can you believe that when the computers were introduced in banks, there was a bun. Whole Delhi came to a halt because all the bankers came down on the street saying that computers are going to take our job, yes sir. Then you have got large language models and there are many new things coming. Just one simple example. 1 million is 10 lakhs. See, down Netflix required something like 1400 days to get 1 million. And ChatGPT crossed it within 1 day. There are 1800 days, 1400 days, and there is 1 day to adopt the thing. When you have got such senior physicians and clinicians around you, there is one question which we always ask to ourselves. What we have achieved? We have conquered some diseases, we have discovered new diseases, we have prolonged life expectancy, we have reduced suffering, improved well-being, sense of well-being. But are we looking for the quality of life? And technology is going to improve the quality of life. Technology will improve the way you should monitor patients. When there are a lot of challenges, there is huge explosion of healthcare data, and so there is a very good concept called a doubling of medical literature fact. In 1950, when Harrison was published, that edition, it had a literature doubling time of almost 50 years. Now it is less than 76 days. And there was prolonged drug vaccine discovery, long drug trials. Now with the help of this we are going to do. One very simple clue to all of you. How would you acknowledge knowledge or wisdom? So initially what you get is a data. This is called as a DIKW pyramid. This is from my friend Avnish Khare. The data gets converted into information. Information gets converted into knowledge, and knowledge gets converted into wisdom. So these are the various advantages of digital technology. Saves time, money, efforts. The torture trouble of travel. Accuracy, big volumes are handled. But friends, I confess that it increases your sheer levels of confidence. I travel all over the country and all over the world. I am never tired whenever I am talking about it. Confidence, concentration, competence, enthusiasm. And don't forget the last A, that is acceptability to learn from others. Acceptability and adaptability. We are running our third certification course. Get all types of odd questions from our students. Only thing that we don't ridicule them. If we don't know, we tell them that we don't know, try to do. So this is the triangle: accuracy, explainability, and robustness when you have got multimodal inputs. And you are the person who thought that I think we are moving into a period when for the first time ever you may have some things more intelligent than us, those which can overtake us. Just remember this name, Geoffrey Hinton, and there is a very good program called 60 minutes. It is an extended TED Talk. TED Talks are almost 18-20 minutes. But this in 60 minutes, there is one scholar who will come and talk about all the technology working. How will you define? It is very simple. It is just a computer algorithm to understand and simulate intelligent behavior and critical thinking comparable to human knowledge. So you have got a machine, you have got an input, you have got a prompt, you have got an analyzer, you have got a huge amount of data, and you get a good output from that. If you want to go into the detail, the ability to make computers do things that require intelligence is done by humans. It is defined as a group of abilities such as understanding, learning, reasoning, making decisions, and solve problems. It emulates these aspects of human intelligence with the means of many number of tools which are going to be there. So with this, I come to the second part of my presentation, that is the basic principles and foundations of AI. Everybody has drive the car. How much technical detail we know about the car? Very few. The same thing is for AI. So machine learning is a part of it, deep learning is a part of it, reinforcement learning is a part of it. Computer vision and robotics. Robotic surgery everybody is aware. Computer vision is what we punch every day in the morning. And this is supervised learning, and there is a concept called as unsupervised learning. These are called artificial neuronal networks, and there are generative adversarial networks. So these are the things which talk to each other. It is like in our brain layer. 1, 3, 4, 5, 8. You get 10 inputs, then the 10 inputs can synthesize the 10 inputs from 1,000 people, and it comes to a conclusion. Those who read Journal of Association of Physicians of India. This was around 1100 days back. But there was a lot of curiosity about. So I wrote an editorial, Digital Technology in Clinical Medicine, how we have progressed from calculators to chat GPT. It is easily available on the website. You can see a lot of references on it. Why you have to, as a medical professional, why you have to adopt the technology? Because if you are having a line of standard of care and this as a performance, this is low, this is the elevated performance with the help of technology will be 10 steps ahead of all other colleagues if you start using and adapting AI. Now the third part, but it is a bit long one, but it is really interesting for you because I am going to tell you how the AI is going to help you at every educational level. So forget about smelly anatomy tables. Physical cadaver labs are expensive, biohazards costly, and the anatomy professors will agree with me that you cannot see anatomy like lymph nodes, certain blood vessels, pancreas in a physical cadaver. And what is the answer for that? You use virtual reality or virtual tool which looks something like this. And as when this was a head mount set. Head mount set and you are seeing in the space the same body can be converted for male, same body can be converted to female. You can delineate the artery, vein, nerve, the muscle layers. There can be a three-way one. So what this table does it? Combines anatomy, physiology as well as biochemistry. You tap on liver, the horrible correct cycle will come into the top. Okay, all these CCCP rings and all the bothering things in your first evidence. So these are the virtual dissection tables. The name is anatomist, and I have been lucky to handle this kind of table. It is really very interesting to go over. So from anatomy, physiology, let us come to pathology. Conventional thing is only 10x, 100x. But can you have a 54 inches TV as your display? And this is not from Stanford or Harvard. This is from Kolhapur. My niece, 6 years, and she sees the thing, and she is one of the expert onco pathologists from all over the world. And we get samples everywhere. There is an app called as a HistoVis. What that HistoVis does, it can go into any detail. And it can give all the findings about it. But if I tell you that you have got a section in front of you, sir must have experienced so many. We get an X-ray studied with cannonballs, metastasis. There you go. Cannonballs, you don't know. So do you have something more? Yes. This is a pathology site which will tell you the site of orthosis. First of all, it will tell you malignant versus benign. And then one step ahead, it will tell you driver mutations. Why driver mutations is important? I know a leukemia cured by one capsule. Maybe that capsule must have costed the family 1.5 crores. But only one capsule, and that cleared the leukemia which was associated with mutation at a specific site. It tells you the structural genomic changes, response to therapy as well as the prognosis. What therapy? Chemotherapy, radiotherapy, or the latest immunotherapy or CAR therapy. So this is a system called as the EMPAIA, ecosystem for pathology diagnostics with AI systems. There is a standardization, there is a validation, there is an India AI mission, there is automated trials, there is a quantification, and it is a precision medicine. If you do see a breast slide, it will tell you all the points in a very precise way, whatever you are going to do. This is the one step ahead for biochemistry. It is called as a microfluidics. What do you mean by microfluidics? You have got a slide this, you put one serum and you get the results. Like that, it can be enhanced to any amount of things, and you will get investigations like anti-probate DMT, you can get LPA just with one slide which is going through the lateral flow technique. You have to take the picture of that QR code, send the QR code to the lab, send the money which is required, the lab will analyze the QR code and it will tell you that your 20 crore will be 4,589. a breathless patient coming to you when you are exhausted with all the bronchodilators. You have given corrected, you have pumped in steroids. Actually, the patient is gross congestive cardiac failure, and that is possible because of the anticoagulating processes. These are the smart flow based platform implementing detection, and you can detect even as low as nucleic acids, you can detect proteins, or you can even detect ions. Those are very important. And the beauty is there is no needle prick, there is no vacutainer or anything. You have got a machine which has got a pump which just sucks up the 8-10 bloods which are there, and what it does, there is a motor, there is a finger pump, there is a heater, it enhances the sample, segments properly, classifies, regulates, and augmentation of the image data set. These are the things which are going to come into every pathology data. Suppose if you want to go beyond pathology and you are interested in doing the genomic analysis. So this is one program which gives you the genomic analysis in a very simple way in front of your computer. You find out the gene mutation, decide whether there is a treatment for it, and you will be telling it. So in nutshell, if the clinical student, as I want to tell you that these are some of the apps which all of you must be using: Amboss, Osmosis, New World, Electro, Anki, and 6K. So these are the apps good for first, second MBBS, they are for third MBBS and for the PG. What you need to do is go to ChatGPT, type only this word, point of utility to me as a medical student in second MBBS. You design your prompt in a better way, and that prompt will help you. The next point of my discussion is the year-wise. After that, we go to the clinical side. How many things in our body can be monitored externally? Almost a dozen. And let us start with the basic. This is a pulse oximeter. But this is not a simple pulse oximeter. It gives me respiratory rate and something called as a perfusion index. So it is a very simple experiment which you can do in your ICU. Just make a chart of PPR, BP, RR, PI, and clinical conditions of patient. A patient who is going to worsen on Thursday, you will say give a ventilation on Monday evening. What is important in daily care? It is not the systolic or diastolic pressure, it is the pulse pressure. If my pulse pressure is going down, my patient is going to worsen. And human being cannot detect the difference between 10 or 8 or 7. But AI can detect and it will give a warning that this person is going to worsen. So this is about your PPR BP. This is obesity is a big problem in the country. Huge. And there are 19 new molecules of semaglutides which are being marketed. And you don't do only height and weight, but do all the body composition analysis that tells you how much of the visceral fat you are having. If you want to auscultate something, this is a stethoscope. This is the made in India stethoscope. It is the next door to you from the IIT Mumbai. 16 times amplification of the sound. Very good for people who are losing their hearing capacity. Not only because of age or the sound, because of the idiotic use of mobile. आणि तुम्हाला सगळ्यांना आशीर्वाद देतो तुम्ही 40 वर्षात बहिरे होणार. जी जनरेशन आहे ना आता ते 40-45 you are going to get deaf. You are losing those phones and your exposure to sound is too much. So in that situation, this stethoscope will help you. What is the biggest problem in BP apparatus? You have to pump. There is a big tube. So forget about that. It is a tubeless and bulbless BP apparatus. It can fit here. You can do jogging, walking, and it will connect to your BP, your mobile phone. It is very simple. Hardly cost 9,000 rupees. Every patient who can spend party on a party 10,000, 15,000 rupees, he can definitely, a clinician can afford it. Now, forget there is no radiology department. The radiology department is in your mobile or your computer. There is no fixing, developing, trying business. But what is the beauty of AI? This is the AI to early detection of chest nodules from the X-ray images. This is the reference Y2. This is a small nodule which you cannot detect. This is an AI enhanced image which tells you whether it is benign or malignant. There is an organization called Zebra Medical Vision. This is our ad hoc radiology solutions and we reduce CA breast risk prediction by 97%, biopsy reduction by almost 30%. So in radiology, medical imaging, huge scope. It has been said that imaging specialists will be totally replaced by AI, but they still require a good amount of clinical tests. Now I give you one more book. Can you diagnose diabetes from X-ray test? 1,46,000 X-ray tests were analyzed. And what was the thing? This is a characteristic detection of the fat disposition in the mediastinum which was detected by AI, which can predict onset of diabetes in next 5 or 10 years. So I have got a good amount of window, therapeutic window to manage yourself in a small amount of time. From X-ray it will come to eye. I have got lot of things, impactful AI solution called as Ocelux, 3 Netra. It is for portable AI screening, low cost, non-patriotic. And a Remedio is a sort of a image which takes from your data and tells about diabetic neuropathy. Not only that, I can tell you about cardiovascular health. It tells you whether you are a smoker, you are a serious disease risk predictor, high risk prediction, and CHF prediction. So म्हणतील काय उतना फेकत नाही आहे, रेफरन्स आहे. This is the reference in which everything was correlated and the internal vascular features were suggestive of congestive cardiac failure with an AI-based evaluation. Something which is going to come very rapid in the next 1 or 2 years is, can you diagnose other diseases by fundoscopy? And which is the most graded, which nobody wants, is Alzheimer's. And we are in the Lancet reference of 2022 400. Predicting heart attack and stroke, hyperlipidemia, Parkinson's, calcium score, liver gallbladder disease, kidney disease, and diabetes and blood pressure control. If your diabetes and BP is not controlled, your arteries will behave differently. Not detected by the naked eye, but the AI tool will detect it. So what is the stage what we do? We have got a agent, the name, then what is the nature of the agent, what is the solution, what is the application, what is the stage. This applies to every AI agent we are building. So there is something called as NIDA. This is a integrated lung health screening for tuberculosis detection. A boy from Pune has done, and this is accepted all over the world. QXR, a chest X-ray and detects more than 30 plus findings. And if it doesn't detect a condition like surgical emphysema, it will be a question mark saying that there are certain image with 30 with this X-ray which I am not in a position to diagnose. This is what we call end-to-end AI, and as told you, radiology is the most benefited branch of medicine. And this is a handheld, light, portable, non-patriotic, and it not only captures but even grades. So this is the way in which the diabetic neuropathy, the retinopathy is increasing, and this is the grading which has been done with the help of AI. And it is very good for documenters. So from ophthalmology, let us go to the physiotherapy department. So what we mean by in rehabilitation, some concept whatever, augmented reality and virtual reality. There is another concept called as the extended reality and immersive reality. The physiotherapist is on the other side. The physiotherapist is in Dubai and the patient is in Rangoon. But they can connect to each other. Not only that, you can practice surgical activities in a virtual world before doing the real things, and you can get the feel of the tissue. This is hard, this is firm, this is soft. You can go get it through the special clothes which we are wearing. There are people who have phobic conditions. तुम्ही कुठल्या पण एअरपोर्टला जा, wall, there are some aunties who are just standing below the escalator. They are going to the floor and they get frightened. So how you can do? This is the head module which is going to help you. Agarro and claustrophobia, very difficult condition to treat. Phantom limb syndrome and the new limb transplant. If you are not aware, it is possible now to implant not only one arm, two arms, all the four limbs together. And it is just happening across the road. It is happening in Nanavati. Dr. Nilesh Sadbhai, he has done almost 17 transplants like this. Few of them have got quadruple transplants, and these people are doing their normal work. So this is the way, but these people, they get a very clear sensation. So that those sensations can be treated with the help of it. So this will be a typical picture. This is augmented reality, physical therapy, and this is the future of movement. You are all aware of games. And I will suggest you, there is one called the Tokyo Marathon. This is the best treatment for vertigo. So there is a platform like this, you wear it, and then you go on balancing yourself. How many things you write out, how many things you pick up, and how steady you are on the road. That tells you about your progress. There are many new things which are coming. Here is the instructor and here is the patient. The instructor is there like this, the patient is in position to understand the degree. So there is a clinical interface, summary, and there is a condition called as a dark application. If I tell you, those you must have seen so many neurology cases, you will not see the word plagia. No plagia, no hemiplagia, no paraplegia, no quadriplegia. How? These are part of the exoskeletons. Very light. People can run with this. There is already, if you go to Delhi airport, second terminal of Indira Gandhi, there is a big army hospital. Here the experiments are going on. These are exoskeletons and the patients are really greatly benefited. They are walking normally on the road without a sticker. So let us go to image recognition. Why image recognition is important? Suppose if there are 1,000 cats and only one tiger. How we are going to count? We are going to see each and every face. There picks up between 6. Okay? Small circle. And same thing, you have got a huge mob outside. Can you recognize their face and can you recognize their emotions? I am a private practitioner. I have got a OPD and there are 5 people who are waiting on the OPD. One is having a stick, one is having a hockey stick, one is having a cricket bat, another is having a cycle chain, and another is having a big danda. They are dandiya khela lalna. They have come to break my hospital. So there is a concept called as unusual belongings. Unusual belonging, gangster asla na, his right pocket will be like this. He has got a pistol. So it can recognize or facial expression. That is one of the best way in which you can reduce the violence in the hospital. So these are some of the examples. It is analysis done with alarms. So these are the different types of realities: virtual, mixed, immersive, as well as extended reality. How you detect skin lesions? These are the different kind of apps. These are the apps which were there. Derma Aid, 50 skin diseases. There are a lot of people who don't have access to a qualified dermatologist. And nowadays no dermatologists are there. They are all hospitals. So you can go to Gemini. Open Gemini, take a picture, give a brief history. That this person has got lesion for 5 days. It is itching, non-itching, it is elevated, non-elevated, and the edges can be felt. It will tell you that it is a fungal infection. So you can try use some simple things. There are lot many things in and around us. This is called as Nemo Care Raksha. It not only monitors the newborn, but it also helps in conducting the TPR BP, which are going to be by the person sitting in the ICU. Dozy beds. Dozy beds are the beds in which you get all the vitals of it, and the moment you enter, it will tell that patient number 17 and 19 are sinking. You don't start from number 1. You jump to 17 or 19. We have got lot of malnutrition. So if you have got something which picks up the photograph and tells you how much of protein, how much is the fat, how much is carbohydrate, definitely a good boon to everybody. In rheumatology, those people who use AI right from beginning, they get maximum amount of revision. In radiology, in using the lab. Suppose you have got a 34, 50 pages report. Take the PDF, put it into ChatGPT, or best is perplexity. Perplexity is good for analysis of scientific. And if you have got 2, then it can compare that how it is going up and down. Same thing for it will give you analysis whatever the things are there, and that will tell you also what type of treatment you are likely to suggest. Now I am sitting in front of sir, I got a very horrible headache. I am describing my headache like a Hindi film story. Sir just keeps a mobile in front of me, listens to all my story, and within a minute the whole story is a word format. This is called as a scribe. Each scribe is one which we use, and you can use even any Google app which is going to help you. There is one called as Suno AI, and this is called as Average. It is an AI-powered clinical summarization tool. You fill all the information which you have got in a digital format and ask a question. Remember that question is important. That prompt is the most important thing. You can analyze the prescription for drug interaction, especially prolonged QT interval, which requires for sudden cardiac arrest. Dermatology we talked about. You just take a picture and it will give you the what is the association, 95% accuracy, and it will tell you so many other simple things. The wrinkles and everything is horrible, but if you have got a Xanthoma xanthalesma, we have to tell this auntie that it is better that you get your lipid profile done and get yourself treated. Don't go to a dermatologist or a hospitalist to get it removed. It is going to help you. 3 skin lesions which all up you want and remember. There is a ring lesion, there is a bleb, and there is a condition called as Stevens-Johnson syndrome, toxic epidermal necrolysis, and pyoderma gangrenosum. This is 1% less than death certificate. These 3 conditions are 1% less than death certificate, and you can identify this at a very early stage if you evaluate the skin lesion in a proper way. So, skin is definitely benefited with the help of AI. Drug discovery is a complex procedure, 50,000 drugs, one output. Now it is very easy with the help of all the different kind of AI tools, and what are the recursion pharma. There are something called a rare diseases. Then there are some aging halter drugs, and there is a deep genomics. Or a organization called a benevolent AI, which combines all the medical problems together. This is our recursion. It tells you the exact which chemical is going to be helpful for the new drugs. So these are the clinical trials which are being done. Very fascinating, and this is the way it is really going very fast, and we will get even a drug trial cleared within a period of 1 year or so. Now, everybody has thought of robotic surgery. So what is the robotic surgery? It is a training and simulation AI module for surgery education, or actually using on the patient. What is the pre-operative planning, intraoperative navigation, and educational or simulational technique? What it uses everything: machine learning, computer vision, and immersive technology, so that the person gets a feel. These are the 2 systems, Da Vinci and MISO, and this is one which is used by the orthopedic people. It reduces the consumable cost by 25,000 and reduces the admission by 3 to 4 days. Accessibility to smaller hospitals to the small tier 2 or tier 3 cities. In plastic and reconstruction surgery, there are tools like Vectra 3D. There is a 3D printing for custom reconstruction. Suppose if I lost my pinna in Excel, and if I got an old photograph which shows my pinna, that will be exactly reconstructed, same skin color, people will not know that I have got an exploded. There is a very good app called as the Burn AID, what is AI driven depth assessment. These are the LDU scanners, they tell you how much the burns are deep. There are not many good things coming on the surgical side. But the best out of is cyber knife. There is no knife in cyber knife or gamma knife. It is the 0.03 millimeter accuracy delivery of the radiation. So any lesion, whether it is malignant, whether it is inflammatory, whether it is infective, can be managed on that. And these are the different things called as the Linux systems or proton therapy. This is the way in which the AI can be monitor our health in a remote way. So what are the things I told you about those few equipments, but there is something add-on. This is the ring called the ultra-human ring. It monitors pulse, most important sleep. Obstructive sleep apnea, a very dangerous disease. If you can pick it up early, you can make a change in the life of the patient. The same ring can be connected to a glucometer also. There is one more add-on to this ring. It will tell you approximately blood glucose. Of course, these are in experimental stage, but it tells you an approximate amount of oxygen concentration. This concept is called as a digital twin and personalized medicine. You create a digital twin of the person of the metabolic process, and then suppose if somebody gets totally uncontrolled diabetes, fasting of 100 and PT of 1200, it will tell you by analysis which dose is going to help for this. Digital twinning is a separate branch itself. This is the ECG machine, it is like a putty. No cable, no jelly, and no leads. Put it on your knee, it will be a 6-lead ECG. In addition, what an ECG can tell you with the help of AI, it can tell age and sex, injection fraction, difficult diagnosis, extent of anemia, atrial fibrillation, peripartum cardiomyopathy, very dangerous disease. Diagnosing it also gives you chills, hyperthyroidism, and the feeling pressure of the heart. Just like that, X-ray and diabetes. Can mammography diagnose ISD? Yes. When you are doing mammography, whatever the calcium score you get of the coronary artery, that will tell you. So this is a full article, review of artificial intelligence for detecting breast arterial calcification mammograms and their clinical implications. From heart, let us come to lungs. In Mumbai, the amount of air quality change, and if you have got your PEFR reading stored in a computer, with the help of one click, you will be in a position to know whether you are likely to get a exacerbation of your asthma. Not only it takes your pulse, BP, respiration, air quality, and your PEF. That will tell that you have to be very careful. So this is about the skin lesion. The lesion which I told you, this is a coin-shaped lesion will be found, and this is going to be malignancy with 80% accuracy. Can you simulate gastroenterology? Yes, it is possible. The nurse is asking that this is stomach, but I am not in a position to find out this image. One of the most dangerous condition in the world, called the aortoenteric tissue. Because of the duodenal ulcer perforates into aorta, it opens into the GI. The patient dies in within 5 seconds. But here it is going to tell that the object remembers earlier what situated close proximity with the duodenum, given the size and location, it is most likely to be the aorta. So it is a condition called as aortoduodenal fistula or aortoenteric fistula. Not many good things are coming in pediatrics and neonatology. One of my students, Deepak Sirdoli, he just wants the cry clip of the side. 30 seconds cry clip. And with the AI data result, he will tell you whether the person is really in more distress or not. This is simple analysis of a physiological side. Gynaec also is definitely very much dedicated with the help of different kind of equipments and early detection techniques. Diabetes. This is our article, and the two things which are happened both after diabetes insulin is called the CGMS and the glucometer. This is the CGMS. But I want a modern glucometer. This glucometer sits on my mobile phone. It doesn't require a battery. It gives a graph how my sugars are going on. Then this is a CGM. There was a 22 years of wait, and now these things are very common. A patient with HbA1c 7.5 can be 0% out of range, 50% timing range, or 100% timing. This is possible only with the help of CGM. There are lot many new things which are coming up. The latest one, you can keep the mobile on the dining table and start eating whatever. The moment you use sweets and peda, the sugar goes climbing. And the needles are changing. The needles are, this is not a single needle. These are the micro needles. Many number of needles are there. And there is a Israeli app which gives you non-invasive sugar as well as a HbA1c. Last 3 points, very quick, how it can help you in research and publications and presentations. Keep this chart ready with you. It analyzes vast rows of data, generating new hypotheses, identifying novel drug agencies, and uncovering previously known disease patterns. So these are what I write best here is for grammar and paraphrasing. Grammarly, ChatGPT is okay. Get a paid version. Don't go for a free version. But Illicit is one of the best software for your research papers. There is a lack of time, I may not be able to show you demo. So literature review, SciSK, consensus, Illicit, and semantic scholar. I just tell you about Illicit. It is an AI research assistant. It answers your research question by analyzing thousands of scientific papers on the same subject. It extracts key findings, data and methodologies to help the brainstorm topic and collect several research results. It becomes easy for your thesis. So these are the different type of tools which you should use for the research, rapid and enterprise level formal, daily data and SAMA. These are the things which are going to help you. But before doing anything, be respectful to the AI agent. General principles are be transparent, specify the two-line version for what you are using, cite the specific output and cite the original source from where, because AI can hallucinate. They confidently quotable. It can be so confident that you will not be able to understand it is like. So you have to use the model. Disclosure of the major use also. Administration, big headache for a doctor. So all the things, planning, ordering, shifting, directing, bidding and everything can be done with the help of good AI. Last but two, future narration. You can get bandages like this, which will sense that there is a reinfection or there is an increased amount of tubular tissue. A hospital gown will look like this. It will give you all the vitals on your mobile phone. All the lab tests will be replaced with patch for sweat glucose or sodium or potassium, and you can record your blood pressure also. This looks like a pendant, but this is a fall detector. This is an American thing. We have got an Indian counterpart of this, Dr. Gurunath Parade from Solapur. We have got a patent for such type of test where you can take ECG on a person who doesn't have limbs, both upper limbs and lower limbs. And if you want to prevent Alzheimer, get help of this man. His company called Neuralink. Get registered as a volunteer there for prevention of dementia and Alzheimer's. So friends, please use your peripheral devices wisely and absolutely sensibly, and you need to validate. Do not use any unvalid ब्लड के कितने तो भेज दिया यूएस से, इंग्लैंड से भेज दिया, इसलिए डोंट यूज इट ऑन इंडियन. It is not going to accept the Indian value. So technology in medicine, there are lot of pros, lot of cons, potential, harmful, effective, lot of screen time for the doctor. You can get technologically addicted, there will be social isolation, it will be disrupting sleep and invited issues, or people ask whether people will be sort of a dehumanization. So these are the perceived disadvantages: job displacement, ethical concern, data privacy, algorithmic bias, lack of creativity and empathy, cost is going to be significant, reliability and trust, and too much of dependency. So these are the four major disadvantages. Black box problem. It is simple. You put a question, it will be answer, but it will not tell you how it comes to continue. So the methodology is not known to it. So the bias, hallucination, over-reliance on technology should not be. This is a big question asked by everybody. Last few slides. Either the computer or technology on a doctor's table is a companion or companion, is a friend or foe. It is going to undermine my personal connection. Before computer, I used to talk face to patient. But when the computer came, I am looking down at the PC and not connecting with the patient. Will it replace a physician? So the answer is no. AI cannot replace a doctor for few things because of empathy, understanding our unique communication skills. There are people who come to me to cry. They pay 1,500 rupees to cry for 5 minutes. But they are renting out. There is nobody to listen to them. So AI will augment you, it will help you, it will assist you, it will make you the upper level of the course. Last question is from where to get trained. Where is the resources? You type in Google, you will get such a delivery stick. So this was the latest editorial in JAPI. Responsible use of AI in clinical medicine with ethical integration and artificial intelligence. This was a framework for the responsible innovation. And there are very good journals. Anytime AI is one. These are the other 10 top sources to learn. The journals you should ask your library to get it. There is a low intensity AI research, so we should increase our H index of publication. And this medical literature time I told 1950 for 50 years, it is 70 years. Do get a scan of this QR code. This is our organization, whatever doctors we have. Be a part of it. I am going to share this with the organizers. Then we conduct courses called as a certificate course of artificial intelligence in medicine. We are coming in a very big conference in New Delhi. There you can present your papers, and this is going to be our new adventure, that is International Journal of AI in Clinical Medicine. I come to the last few slides. You have seen my first photograph. This was a black and white photograph 1974. This has been colored with AI. I cannot forget my family. My teachers, many of you may be knowing Dr. R.D. Lele. I was very fortunate enough to compile his autobiography, Pursuit of Excellence. Dr. Soltur and Dr. Sanpur and Dr. G.S. Kulkarni, 93-year-old, still active. And they are all my best teachers, my grandchildren. So friends, be optimistic, informed, empowered, futuristic, Atala to be determined with a bit of knowledge on AI in clinical medicine. So finally, we have covered all the 7 topics which I told you. Satya Pe Satta is over. If you want this presentation, this is my email ID, this is the card. Don't forget these 2 events. MapCon 2026 in Nashik. And thank you very much. I just want to ask one question, and I want everybody to say it loudly. Are you ready to use AI revolution in healthcare?
Yes.
Say it loudly, yes.
Yes.
Just 1 hour. Thank you.